What we see is there's still a lot of variety in access of CAR T to patients, and that ranges from in an exclusion criteria to also that we see that access on a national market and reimbursement. There's a lot of variety in different countries. So in one country, patients notified there is CAR T, but when it comes to their own country, it's not being reimbursed. Well, they see in the media that it's a possible cure, and of course they understandably want to have that, which will save their lives. But what we see is that health technology assessment institutions are also struggling with how to put value on CAR T. There's some debate whether the models are right, yes or no. And I think from our perspective, well, we do have to realize that health technology assessment, they have to put an economic value on CAR T, but it's also about achieving good healthcare systems and a good healthcare. So it involves integrity of all stakeholders to make sure that patients get the healthcare that they need, where they live, but also that it's not too much of a financial burden, as we as society, we share all the costs. So all this has to be taken into account. Now what we see is that because there's a lack of data of survival in the long term, and it adds millions it has enormous budget impacts, we see that there are differences in access to put it on a market in regulation. So from our perspective, from patients' perspective, we would be very clear in the information that you perceive. Do you realize that patients are hoping to have access to this treatment? And just be very, actually what we have to be needed on the market without having to have the biggest, highest price, because for some countries it's not available to pay that price, to pay the full price for a product like this. But we want it within our reach.